Food and Drugs Authority, and other regulatory agencies. Ladies and gentlemen, it is our firm belief that the Lightware e-healthcare solution and the Ministry of Health engagement will implementation. Lightwave, in collaboration with the Ghana's Disease Surveillance Unit, has developed hemorrhagic fever, cholera, and yellow fever, just to mention a few. The electronic system has saved Ghana millions of cedis in minimizing claims falsification, verification and validation issues, and ensuring timely submission. Providing improved patient record portability and accessibility, reduced waiting time and increased efficiency, enhanced clinical decision-making and patient safety. It has also reduced human errors and claims rejection, increased accountability and transparency. These achievements demonstrate the transformative impact of e-health in Ghana, positioning the country as a leader in healthcare innovation. Thank you very much.
Thank you very much, Mr. Eric Ejay, for throwing lights on the reason why we are gathered here this afternoon. Thank you very much. Ladies and gentlemen, I have the honor once again to acknowledge the presence of all directors, deputy directors, and heads of departments of Kolebu Teaching Hospital who are with us here. Kindly give us a wave, and let's acknowledge these of Kolebu Teaching Hospital. Thank you very much. We are privileged to also have the parliamentary candidate for Ablekuma South, Mr. Samuel Sabah Latte, aka Teacher Ago. Yes, that's him. Yes. You're welcome, sir. It is now the turn of the Director General of Ghana Health Service, Dr. Patrick Kuma Abuaji, to come and speak to us. Please, let's welcome him with a round of applause.
Thank you very much, Mahmoud Baumia, my regional Honorable Minister of Health, Chief Director, our directors, Ministry of Health and Ghana Health Service, and the teaching hospitals, the CEO, acting CEO, Kolebu Teaching Hospitals, ladies and gentlemen. I am indeed excited at the commissioning of the Lightwave Health Information Management System, popularly known as the LIMS, a singular electronic records, medical records system that has several and numerous benefits to the health sector. The Lightwave Health Information Management System has been deployed in 466 of Ghana Health Service facilities as of 25th of October 2024. We currently have another 68 facilities undergoing the networking phase of the deployment and shall soon complete all process and go live. It is, however, heartwarming to say that all our regional hospitals, that's the 9 of them, 240 district hospitals, 61 polyclinics, and 141 health centers are currently live on LIMS, and of course can seamlessly refer cases to and from our hospitals, including the teaching hospitals, which indeed were the first to have been deployed. We have seen the many benefits of the use of LIMS, and we have clinical, operational, technical, and economic benefits, as well as benefits to the citizens of Ghana and the government and more. And as enumerated by the teachers, what are some of the clinical benefits of the use of the LIMS? It has improved continuity of care, access to comprehensive patient history. It has also enhanced diagnosis and treatment, even as accurate and up-to-date information. It has reduced medical errors. It has minimized duplication of tests and medications. And we also have better disease surveillance, early detection, and real-time tracking of outbreaks of diseases in the country. So, Your Excellency, what are some of the operational benefits of LIMS? It has helped us streamline our work engagement and secure access to their records. We also have better resource allocation because it's data-driven in decision-making. The economic benefits, Your Excellency, includes the cost savings. We have reduced paperwork, has improved efficiency. It has improved our revenue cycle management, including accurate billing. It has improved revenue generation at health centers as leakages are now significantly blocked. What is the population benefit of this system? It also has improved public health surveillance in real-time disease tracking. It has enhanced epidemiological research, access to comprehensive data, and better health policy development. These are all data-driven decisions. As we say now on our dashboard, we are able to see facility. We know in that enclave there must be a problem and allow us to respond much quicker. What has been some of the technical benefits, sir, Your Excellency? It has a uniform data format. It is centralized data protection, so it's secure. It's scalable. It's easy to expand to other places, even when the hospital expands, and it is flexible. It's adaptable to change in healthcare needs. On the issue of governance, it has improved healthcare governance, data-driven decision-making. It has enhanced policy development, which is also evidence-based, improved accountability, better resource allocation, and improved international cooperation because we have reliable data to share. On the area of early detection and real-time tracking, the tracking of epidemic-prone conditions, as said earlier by Eric, through routine surveillance reporting and alerts being displayed on our dashboard allow us for early detection of outbreaks. Automaticity of the displays on the displays of the dashboard enhances detection and reporting of outbreaks. Your Excellency, we at the GHS have experienced all the advantages or gains LIMS offer, and I'm very happy that we have this opportunity. It was used during the COVID-19 through LIMS. There are a few issues that we are working through, such as the change management and the use of paper alongside the LIMS and other areas such as interoperability, but we are definitely on our way for a good cause. We strongly believe that a singular electronic medical system such as LIMS shall transform Ghana's healthcare landscape, improve patient care, operational efficiency, and economic outcomes. Thank you very much, Your Excellency, for leading us.
Thank you very much, Director General, Ghana Health Service. We are blessed this afternoon to have the CEO of Lightware as well. Help me introduce Mr. Samson Jabbar. Wow, the man himself. The man himself. Thank you so much. Now you can see. The media at this point will roll a documentary on how the LIMS will be used, and I'm sure you are ready for that. Can we get it rolling?
Project. Ghana's healthcare system has long faced challenges in patient data management and disease surveillance. But today, a revolutionary project is changing the game. The Ministry of Health's National eHealth Project, powered by the Lightware Health Information Management System, LIMS, is streamlining healthcare services across the country, placing Ghana at the forefront.
We are able to access information quickly and act upon them, providing better care for our clients.
Healthcare establishment managers have always been searching for electronic software that can do digital work for us, especially EMR, electronic medical records. We're searching for a software provider. That time, those available were the ones that will be able to help us speed up our electronic archiving of medical records. It means that it was still paper, but we're archiving them such a way that retrieval becomes easier and then missing folders was minimized. The Ministry of Health gave me the opportunity to lead that pilot, not only in Cape Coast Teaching Hospital, but to lead it for the central region in general, because their software had embedded in it, integrated. We piloted it for 2 years and it was very successful. The banks that were collecting our monies, and in some district hospitals, there were cash collections. That also has its own problems because of embezzling and then pilfering and thieving here and there. But Lightware Health Information Management System that was introduced was so able to adapt to our stores management systems such that we could know the utilization of your stores, the stocks that are available, the stock value, and how much stocks you have and how long it can last you.
Since we enroll LIMS, our IGF revenue, that's internal generated funds, has virtually doubled. All the leakages that we had in the past have all been sealed now, and we are sure that all the money that is billed comes to the hospital. As a manager, I also get real-time access to the finances. So as I sit here now, I can just click and know how much has been generated, and it makes sure that there's accountability. For lab services, everything, we know that because of the LIMS, your results are always available. Your x-rays, your ultrasounds, everything is stored on the LIMS. And the good thing is that when you go to other facilities, you can also have access to it.
One of the key things with the impact of LIMS has to assess any information from another facility and then also continue from there. And sometimes there's no need to even repeat certain investigations if the family physician is a key factor for being in here. So we are able to continue with the care that we have to give to the patient. And with the integration of the NHIS and then also with the Ghana card, then it makes it much easier even to kind of enroll clients onto the system and then also be able to retrieve their data. So it has really been very helpful in that regard.
And especially if you consider documentation. We are living in an era where patients have become fully conscious. Health providers have also become aware of that consciousness. And so if you have a system that helps so far as documentation is concerned, it makes it much, much, much better and safer. But quite apart from that, the fact that it is possible to have access to patients' data, patient information across hospitals, I believe that it is a good thing.
I remember when this system came into force, some of the senior doctors were not willing to use it because they felt that, look, they are not computer savvy or IT savvy, so they need secretaries and so on and so forth. But when they understood, doctors who used to sit and see same number of patients, maybe from 9 to 8 in the evening, they were able to see the same patients from 9 to 3. 5 full hours cut off. So obviously that affects the patient waiting time, because if you are here to leave 5 hours earlier than you have left, that is a lot.
It was also possible to get your finances on a daily basis. How many people are paid, how many people are yet to pay, and how much they owe. So the hospital was on top. And I can tell you that when it was started, most of the hospitals got their internally generated funds, the IGF, tripled, because it was very difficult to embezzle money from the electronic system.
With the Lightware Health Information Management System, LIMS, patients enjoy seamless continuity of care.
The folders, and so storage becomes a problem. We have heap pile of them. We have to go through them, and so it delay patient care.
cost of production for folders is totally out of the way now. I mean, all of that is channeled into the software that we are using currently in the hospital facility.
We have had instances where patients will come to the hospital sometimes at dawn, 3 a.m., 4 a.m., just because they want to just come and queue at the records office to get their files retrieved for them. This is no more in the hospital because now the IT system, the computer system is such that every patient who comes in with a digital number registration, the retrieval of the electronic record, medical records of the patient is instant, And now we are also able to do very good appointment system with the patients because there's very little waiting time.
Initially, when we had to manage folders, you had people's personal information on sheets of paper that could be handled or viewed by anyone. But now with the LIMS system, you have this in a software that you need to have certain credentials to be able to access. And so that improves confidentiality for our patients as well.
We began the hospital less than 2 years. The space for storage of folders was occupied. Now we have done away with all those folders, so we don't need space to store, paper information.
This is where we used to keep our manual folders. And it used to be a very difficult working environment. But then when we ran out of space, we actually didn't have any choice than to use this space. So this space was actually created as an underground to absorb water for the female ward. But unfortunately, when we ran out of space, keeping the manual folders, we have had to make use of the space to store our patient information. And that's what we're going through. We used to battle a lot with reptiles and so on and so forth. And then continuity of, adding folders, because on a daily basis, we used to still add new patients onto our stock, and that became too huge a burden to contain. So I remember when, as a facility, we heard Lightware were deploying an electronic system to see what we were going to, and apparently the region facilitated our hospital along Kede Government Hospital for first deployment of the LIMS. We have to say that this has saved us a lot of troubles. So you can even see some of the cubicles where we kept patient folders. Visibility or lighting was an issue, as you can see here. So any patient who came to the facility, we had to retrieve the patient. We kept folders according to years. So that is how difficult a challenge the manual or the folder system used to be. Now we have almost every patient folder electronically just sitting on our systems, on our computers. And I don't think anything can come handy than the electronic system.
Initially, patients' relatives go to the pharmacy holding the patient's folder to go for medications, prescribe medications for their relatives who have been admitted at the ward. But with LIMS, they do not have to go through that stress, and then it has a form of confidentiality because there's no way the relative will be able to get access to the disease we see, and then confidentiality. Also, there are instances that initially, when you go to the OPD, you'll see nurses holding bulk of folders, but since LIMS was introduced, you post names, some of the patients listen, some of them also will say that this is not how my name is being mentioned, and then it causes a lot of chaos. So that one too has been resolved.
Initially, when the project was brought to Korle Bu, it was piloted at the polyclinic. And after the polyclinic, it needed to be implemented in the main hospital. Korle Bu is a very big hospital with several departments. And unfortunately, when it got to the time to implement it in the main Korle Bu, it was around that time that the COVID-19 pandemic, other departments were scared. That started the implementation at the accident and emergency. And I started it against a lot of resistance from some of the other department doctors, because they were saying that then, Dr. Kwati, if you went ahead to implement LIMS, we will no more come. We are afraid of contracting the virus, the COVID virus. And so if we touch any computer, we are likely to get infected. Following the implementation, who were protesting now realize that of the paperless, the bills, electronic patients bills by human, about the accident and the
enabling healthcare professionals to make informed decisions.
I think
those times you are waiting for, you don't know where to get labs, or they go there and then they have to carry a paper. Now everything is one click, and then they get it done. You sit at one click, you get your results. So we are able to sort out cases or patients very quickly. So they are not, they don't sit for too long in the queues before they get sorted out to go home.
The system's early warning disease surveillance capability detects potential outbreaks in real time.
I would say it's the base, because it tries to eliminate the human factor.
Not
and introduces automation and presenting with a set of clinical features. The doctor will come out with a diagnosis, and then if it's a kind of epidemic condition, we now put it on what they call a case-based form. So that one somehow at the discretion of the doctor. That's the superior part of LIMS. So let's say somebody comes to the hospital and he has diarrhea, and gastroenteritis, it's not a public health problem, but we have built a set of criteria. The LIMS system will be sent to us that will help us suspect cholera. So to us, that is the advantage that LIMS has, which we find the interest in. So if you look at the dashboard for let's say for LIMS now, there are some tabs that so if you look at, let's say, the surveillance data tab, so that one will give you an idea of all suspected 30th. So this is what clinicians have suspected to be, let's say, cholera. And so far as we make that, it is 31 cases that we have suspected. So it is not the doctor telling us, but clearly so far as they made the diagnosis. So this is where the doctor has made a diagnosis. But assuming the doctor does not make a diagnosis, and by way of his examination findings, we see diarrhea, we also see dehydration. We have this alert that diarrhea with dehydration is somehow equal to cholera. That will give us a better sensitivity of the suspicion. So here we realize that if we have, let's say 31, if you decide to now go to our customized surveillance data for the same system, let's see. So in that case, our system is, we now have to now probe further that how many of these record comments, suspected cases are cholera. So that is the superior part, because here the doctor does not even suspect cholera, but because we are putting an alert system that says that diarrhea with dehydration is cholera, we will now go further, and that's how they think that LIMS supports our surveillance system by improving the sensitivity for us. So for us, I think one thing I need to state is that our initial concern was how expansive is LIMS, but now with over 400 facilities, I think that we are ready to go. Hopefully, we intend to scale it up to involve the regions. The regions will have their own dashboard, and then the big facilities will also have their own surveillance dashboard, and follow. And we will now go on to really look at dashboards at the district level. So that's the way we want to move on with the LIMS with respect to the surveillance systems.
The advent of light.
Do it better. We wish to inform you that the video will be available on all social media platforms, the MOH website, as well as that of Kolebu as well, so you can have access to that. And the one speaking, Dr. Siedu Queen himself, is in our midst. Thank you so much, Doc. Give us a wave. Thank you so much.
Ladies and gentlemen, I personally call him the multiplier. So you give him a mustard seed, he will give you a plantation. He's the same single man who recreates the hope in national health insurance, and today, everybody believes in the scheme. He was then promoted to be the minister responsible for health, and he has been today addressed as the commissioner of almost all the projects. The royal of Lejakuku Terminator, the man himself, Dr. Bernard Oko Boy.
Thank you very much, Mr. MC. I'll talk to acting CEO who will do something about your position. CEO, let's talk after the program. Your Excellency, our cherished Vice President, Dr. Mahmoud Baumia, the Chief Director at the Ministry of Health, and all other directors, Director General of the Ghana Health Service, other heads of agencies, health sector development partners, friends from the media, our cherished Kolebu staff, clinical and non-clinical, and friend, PC for Ablekum. Distinguished guests, my brother Samson Jabba, absolute pleasure to be here with you to commission this transformative project, the Lightware Health Information Management System. There was a time, not too long ago, when if you wanted to find a patient's records, sometimes you even needed a flashlight. You needed a good map for a patient that needed medical attention. Your Excellency, it was like playing hide and seek with paperwork. And if you are lucky and you find, Your Excellency, we are entering the era of data, the era of digital transformation. That we were about 40 any developed country, almost 100 years ago. When we were using the folder then, the British were also using the folder. But in the early 80s, they let go of the folder. The folder era is gone. But Your Excellency, as a practitioner, I just want to be very, before you see a patient. One of the hospital-acquired infections is the folder. Everybody touches it till it gets to the pharmacy. And we are happy that we have digitized and moved away from this age-old transmission vehicle. We thank you, Your Excellency, for inspiring this transformation drive. Your Excellency, if you've been in a district hospital or regional hospital before, some people come, they are in a hurry, they are very sick. And so sometimes, it's not all the time. I call them wild people. Sometimes they are not even hospital workers, they are around the hospital records. They can tell you if you have some money, they can get to your folder right now. And so ordinary Ghanaians sometimes, we want this country to develop. But these are the little things that tell us that we too, we day in this world, we've also come of age. I will not mention the station. In the hospital, they will not wait for a folder. They will just type on a laptop or computer, and then all your details show. And I called into the station and told them, you don't have to go far. Come to Kolebu here. It is happening. And the journalist was shocked. And so I'm very happy that we are here achieved in Kolebu and beyond. Your Excellency, your leadership has made it possible for us to take healthcare into the digital age. You saw the need to bring healthcare services up to speed. And instead of just tweaking things here and there, you said, let's give this thing a serious upgrade. Your Excellency, an upgrade. LIMS is going everywhere. We are not just talking about hospitals in big cities. Every district hospital now in this country has been connected in many areas. Your Excellency, we are talking about 21 million individuals, 21 million Ghanaians now have their data captured. 62% of the country is covered on this system. And we are working hard to make sure that the coverage becomes 100%. But one very important advantage is that you cannot mix two individuals because their names look similar. Your Excellency, there are many, I don't want to use medical terms, they cut someone's leg through surgery when it was not supposed to be the person. Is that possible? Two records are the same. No matter how close the names are or how similar the individuals look. And these are some of the very important advantages of going electronic with our records system. Your Excellency, it also helps physicians or medical staff to do the right diagnosis early. If you have a woman who is coming from Kumasi, is in Accra, and has a very bad fever, and you don't have their records, you would ID all the woman's records that this is a woman who has. Your Excellency, there is transformation. It looks like only the boss. They said I should and help them to also go digital like we have done with the public sector. It is my prayer that we support them because whether private or public, this happened. From our partners to our staff here at Kolebu, to the Lightware team led by Samson Jabahi, to our friends at the Ghana Health Service, to all those who made this possible, including my predecessor, Honorable Kweku Ajimamenu, who put in a lot of effort, to our Dr. Mahmoud Baumia, and I want to say, I mentioned Dr. Baumia's name because when this project came up, some people said the way to go is to do electronic databases. And so I'm happy that despite the cost, Ghana has paid for it. And it is always possible. I want to thank Adodankwa Ekufuado. Can be done right here in Ghana as well. And for Kolebu, I want to assure you in particular that we will continue to work with this hospital so that this hospital becomes the best in the African continent. We are going to work with you to do that. God bless the team at Lightwave. God bless all our health.
I'm told is the dribbler of Lejokuku, the terminator of Lejokuku. Please, let's invite the MOA Vice President to speak to us.
Since the day.
Thank you very much, Kolebu Choral and MOH Choir. Now the moment of truth. Ladies and gentlemen, we now invite the second gentleman of the land, Dr. Mahmoud Baumia. He is going to speak to us. You're welcome, Your Excellency. you. Thank you. Thank you.
Thank you very much. Please take your seats. Thank you. Yeah. Thank you. Yeah, thank you very much. The Honorable Minister for Health, Dr. Bernard Okogbo Afis Adams, the Director General, the Acting CEO of Kolebu Teaching Hospital, Dr. Osu Sechere, the CEO of Lightware eHealth Solutions, my brother, Mr. Sapson Jabba, Directors of Kolebu Teaching Hospital, development partners, our incoming Member of Parliament for Ablekuma South, Honorable Teacher Ago, friends from the media, distinguished ladies and gentlemen, good afternoon. I am honored this historic day, and it is a historic day, to commission the National eHealth Project today. I've been looking forward to this day, and I'm grateful to God for bringing us this far. Ladies and gentlemen, the fourth industrial revolution has propelled significant technological advancements that have reshaped societies in most developing countries, Ghana included. Digital revolutions, digital through the government's aimed at revenue mobilization in Ghana. Notable among some of these initiatives have championed mobile money interoperability. Additionally, have championed the universal QR code payment system, the paperless health sector, have championed pharmacy platform, paperless health sector, have championed pharmacy platform, drone-based of the National eHealth Project, which we are commissioning today. And these have revolutionized. Very happy today. This is really a great day for Ghana. As you have heard, we confronted a major problem of lack of accessibility by the medical practitioners to data and to timely data on patients talked about. And you saw the state in which the folders were being kept, in, how dark some of the places were and how difficult it was to retrieve some of these folders. And you could go to the hospital and you'll be told your folder was missing and they couldn't find it. And you had this problem, and you had also a problem of a lack of networking of the hospitals. And these were the problems we had to, gentlemen. I'm very excited by this LIMS initiative because an integrated electronic medical record system is crucial, such as LIMS, consolidate patient information across healthcare providers, enabling a more coordinated, efficient, and safe approach to patient care. Deployment of the LIMS application as part of the National eHealth Project and effective healthcare across public health facilities. Through the Ministry of Health, engaged Lightware eHealth Solutions Limited to pilot region. Following a successful pilot of the project in 2018, approval was given for the ongoing, has seen the deployment of the LIMS in about 481 health facilities, made up of all psychiatric hospitals across all the 16 regions. And we are ongoing at health centers, which are the 6 teaching hospitals, 10 regional hospitals, 243 hospitals, 3 sites deployed with LIMS. with over 1,000 health centers deployment currently ongoing at the moment. This is really massive when you think about it. So today, as you were told, if they refer you from Wa or Joaboso to Kolebu, you don't need a folder. You just need your ID number. And when you get to Kolebu and you meet Dr. Usu Secretary, he puts that in your number in the system, all your medical records will appear, whether you are from Joaboso or Wa or Tamale. That is very, very good for healthcare in Ghana. Ladies and gentlemen, the impact of this project on deployment of limbs, there were challenges with easy and timely access to patients' health records, portability of patient records from service point to service point, legacy silo systems, inability to track and process revenue, manual process for NHIA claim submission, and limited data for decision-making at the various levels of health administration. Ladies and gentlemen, the days where patient records and case history existed in silos are no longer with us. Because of the introduction of the LIMS application, this has facilitated patient record portability to any LIMS, his or her folder across different health facilities. It has also eliminated paper patient folders, elimination of folder, container, and storage space costs, availability of real-time data at the point of care, improved revenue accuracy. You've seen some of the hospitals. You have also easy and accurate submission of NHIS claims. And this system really reduces fraud in NHIS claims or department to department. Hospitals and health centers running LIMS have reported average improvement of revenue of about 30%, with the regional and teaching hospitals are reporting over 40% improvement in wait times. Ladies and gentlemen, the deployment of LIMS has improved access to actionable epidemic information in a timely manner. And you know how devastating an epidemic can be to the economy. It can be really, as we saw with COVID, it can be totally devastating. And so the key is timely information so that action can be undertaken. The purpose of real-time surveillance is to advance the safety, security, and resilience of the nation by leading an integrated biosurveillance effort that facilitates early warning and situational awareness of biological events. LIMS has demonstrated that it is capable of tracking and alerting symptom sets of data in real time to the disease surveillance team. The impact on reaction times and isolation protocols changed from days or weeks to minutes or hours. Here it is the medication budget of Ghana. This model can be expanded to other diseases so that medication budgets can be better and purchases of medication made at lower prices. As we are all aware, drugs and pharmaceuticals make up 50% of the health revenue. Cost containment measures supported by the project has improved solution, allows for real-time validation of a patient's NHIA insurance status, confirming a patient's coverage eligibility from uncovered patient visits. LIMS builds the NHIA claim at each point of service. All completed claims are ready for review and submission based on facility process. This has greatly improved filing time and accuracy, and timely filing at sites running the LIMS software. Yes, you can clap for them. Because the LIMS application checks the claims rules at each point of service, inaccuracies are being detected immediately. The end results are only claims that meet NHIE standards can be completed, reducing fraudulent claims. At this point in time, across the hospitals where the e-health project has already been deployed, nearest access to specific tests and medical services, availability of specialists, and load on inpatient and emergency wards. A real-time dashboard with these parameters being tracked along with 40 other useful parameters for public health teams is already deployed for use. Ladies and gentlemen, the National eHealth Project has been deployed as a holistic healthcare platform. Real-time data collection from connected LIMS facilities has provided health stakeholders and disease control experts a unique opportunity to enable health policy decisions for the entire health continuum in a manner never envisioned before. Ladies and gentlemen, as security and reliability are critical three pillars of security, reliability, and availability. So all electronic medical records have to be built, around security, reliability, and availability. It is encrypted, shadow copied on multiple secured servers, locally available at facilities, so internet downtime and unavailability do not cause problems with patient care. In event of a local failure, this bidirectional feature of the LIMS system provided the greatest opportunity for a successful patient outcome. Again, the rollout of the LIMS application has become the main backbone for integration of all other services and operations at health facilities deployed on the LIMS. On-site banks across these facilities have been successfully integrated with LIMS to facilitate cash payments, reduce wait times at cash counters, and improve visibility of funds at the hospitals. Diagnostic equipment such as analyzers are all integrated at the various health facilities. The initiative I launched last year is the issuance of Ghana card number at birth, which is integrated with the clearance details at the various hospitals. And so under the Ghana card at birth, when the child goes for weigh-in, a Ghana card ID and a birth certificate ID at the same time. So that was a major reform that we brought in. The National Electronic Pharmacy Platform, which I also launched in 2022, which in the country is also integrated with the LIMS for drugs data at the various facilities to ensure continuum of care. It really provides us a very solid foundation for telemedicine in this country. And so you're seeing NHIA beginning to put in place the telemedicine for patients who don't really physically need to go and see a doctor. And they could see the doctor from home remotely and leave more patients who need to see doctors personally the space to do so, and it will unclog the waiting time. So I think the telemedicine and the future of telemedicine really is upon us with the LIMS that has been now done. The CEO of Lightware Healthcare Solutions, Mr. Sampson. This man is a bit special. He's a bit special. He's brilliant. He's brought him, so proud of him for what he's doing globally and what he has helped us do in Ghana. I think that he deserves a round of applause. The Lightwave applause, because a lot of the time we get a lot of sleepless nights, many sleepless nights. I've been on the phone several times with Mr. Jabba at various times as we move this project through to get it done. But they have been very professional and very patriotic. They wanted Ghana to achieve what we have achieved today, and I want to thank him and everybody. I want to thank all the other players, the Ministry of Health, the Ghana Health Service, the health facilities that have all participated in this. It's been a collective effort, and I'm really, really, really proud as a Ghanaian with what we have done. Not many countries on the continent have done or have been able to do what we have done. And I really am looking forward for Ghana. Ghana is moving to bigger things. On Friday, I want to note that Ghana will launch 5G on Friday. 5G. We are moving to 5G, which is a major, really major undertaking for our country. And 5G changes so much for the digitalization agenda, because the speed of 5G is 100 times the speed. You look at 5G and it has 1,000 times more capacity than 4G. So it's got capacity for hundreds of thousands of devices working seamlessly and communicating. And it's set to transform sectors like the health sector, 5G, and what we are doing. This is really going to be helped. I mean, what we have done with e-health is going to be really helped with 5G. Health wearables, for example, are able to reliably transmit data in real time to medical professionals. And so you will be able to get into a situation where maybe you're about to have a heart attack, and we better get you into the hospital. Well, sitting, you are thousands of miles away. So we are in a whole new era with 5G coming in. So we're going to continue building on this. At this point, ladies and gentlemen, have helped to make this possible. And I wish to take this opportunity to commend the Honorable Minister for Health, Dr. Bernard Okoboy, and his predecessor, Dr. Kweku Ajimamenu, who was working very hard on this project, as well as the Ministry of Health and the Ghana Health Service for successfully organizing this event along with Lightware, and to look forward to the completion of deployment at the health centers and the CHIPS compounds and private facilities to facilitate better patient outcomes and healthcare delivery across the country. I believe Ghana has reached a major milestone today, and I keep saying it is possible. Thank you very much. Thank you for your attention. God bless you.
All right. Wow. Thank you. Thank you. All right, thank you. Distinguished ladies and gentlemen, Ghana cannot compromise on the demand of a digital-oriented leader at this point. When one washes his hands well, he eats with kings and leaders. And consistently, when you keep eating with kings, possibly you'll be crowned as a king. And I hereby present to you the man who just spoke, the next king of the Republic of Ghana, His Excellency Alhaji Mahmoud Bawumia. Let's do it for him one more time for the words of hope. Thank you so much, Your Excellency. Thank you, thank you, thank you. All too soon we are coming to the end. Distinguished ladies and gentlemen, help me welcome Dr. Priscilla Van Dyke C. head of Kolebu Polyclinic, to give us the vote of thanks.
Hello and good afternoon to everybody. His Excellency, before I go ahead with the tax ahead, I want to say that Kolebu Polyclinic Family Medicine was the first department that the limbs were successfully rolled out. A lot of things get piloted in Kolebu Polyclinic, and I hope that one day soon, when there's a pilot of an infrastructure project, our department will be considered. So I'm here to give the vote of thanks, so kindly give me your attention. First of all, I want to thank with the LIMS project such that it's being formally launched today. So we thank God Almighty. Secondly, I want to thank the Vice President of the Republic of Ghana for taking time off your busy schedule. We know it's campaign season, but you took time off to come and formally launch this e-health project. And we know that indeed, to the Honorable Minister of Health, Dr. Bernard Okoboy, we thank you for your return to launch this project hospital. Thank you so much for of the Ministry of Health, our health, who came to support him as well. We also want to thank the directors from the Ghana Health Service who joined him to support the launch of this program as well. I also want to thank all members of Parliament as well as the MPP Parliament, to our acting CEO, Dr. Frank BMC's staff of Kolebu Teaching Hospital. Thank you for your time and cooperation for the rollout of LIMS and your eternal Chief Imam Wave. We thank you so much for. Additionally, to anyone who doesn't fit any of the categories I mentioned, I want to thank you all so much because we are a good teaching hospital and also in Ghana. Thank you so much for your attention.
Thank you very much. Let's do it better for Dr. Personal from Say, head of Polyclinic. Ladies and gentlemen, we've come to the end of this Daru Shaban to give us the closing prayer. Please, if he's around, let's welcome him with a big round of applause.
Excellency, the Vice President of the Republic of Ghana, the Minister of Health, the Acting Chief Executive Officer of Coordinate Advocates for telling the closing prayers at this historic, momentous occasion that marks the launch of Ghana's major digital health in His Excellency Dr. Mahmoud Baumia in the health sector. Ya Allah, Ya Rahman, Ya Rahim, decisions that continue to benefit the people of Ghana and particularly the health professionals in the health sector. Ya Allah, bless this digital health intervention with success, accessibility. Amin. Ar-Rahman Ar-Rahim, Maliki Yawmiddin, Iyyaka na'budu wa iyyaka waladdallin. Amin.
Thank you very much, Al-Haji. Ladies and gentlemen, we've been your MCs, Dr. Emmanuel Lloyd Bafo, Jay Bafo. We are so grateful for your time. Taking a group photograph. After that,